Welcome to your Mind Your Body. This is another episode of AAA. Ask Audra Anything. This can be wild. This can be whatever you want. Whatever you have not had the guts to ask your own doctor, I'm happy to answer it for you. You can always shoot me a message on Instagram at Dr. Audra Lance. Questions will be kept completely confidential. So let's get into this. What up, my butthole breathers? How are we doing today? I'm coming to you live. Well, not live, but I'm live right now if you're watching on YouTube from the beach. I'll have you take a look. I was working earlier this morning and saw dolphins go by. I mean, pretty cool, right? I did this because I preach that you need to set yourself up for success. And when I'm in Nashville or traveling for work, like my priority is my patients and seeing and treating them because that's the most fun part of my job. Although this podcast is a tie-in. I love this. But I put everything else on the back burner and I'm like, oh, I'll get to it. I'll get to it. And when you're a business owner, like you have a lot of other shit you got to do. So I set myself up for success by making myself go somewhere by myself to work. And while I'm doing that, I'm also like recharging, going for my walks, working out, walking on the beach just to like calm my nervous system. Because when I'm calm, I get all these incredible ideas. That's when you're the most creative. That's where some of these answers to some of these cases have come. It's just like getting out of the thick of it and putting myself in a position where I am leveling up, giving myself the edge, getting to the next level. So this could be like just go to your local coffee shop. Just set yourself in a different environment to be more productive. So that's my tip of the day. Let's get into, I'm saying so a lot today. I'm pretty jacked up on coffee. I walked my morning walk. No, I did. I walked down to the coffee shop. It's like 2 miles. And then I slowly walked back drinking my coffee. And now I'm jacked, which is why I'm not drinking it on the screen to share with you. I actually have some water. We got to like tone it down and balance it out. That's a good question. What is your balance for coffee? Is it 1 cup? I'm pretty much a 1 cupper. If I do more than that, it has to be like half calf, or I'm kind of got the shakes, and but I like it. That's the sad part, right? You're like, oh, I'm kind of addicted to that shaky feeling. I feel like I could take on the world, but there's always that crash, so you don't want to do that. This is where you got to play with your body. What are you going through? What are you eating like? All the things to get that perfect balance. And that kind of goes with anything. This is like your workouts, your treatment, your nutrition, your sleep. You got to, and your body will ebb and flow, kind of like a roller coaster. It's just going to change depending on how much stress you have in your life, right? And what's going on and what the situations are. I'm getting off on a tangent, but I like it. Again, so now I'm going to just do it. Let's get to some of these questions that I've gotten. Thank you for reaching out, saying hi on Instagram. It's me and my DMs, it's me responding, and just having the courage to like ask some of these questions. I love it. And on that note, thank you so much to all of you who have hit the 5-star reviews, written a review, sent me a message about it, shared this with some of your friends and family who you think that episode might resonate with. I am so grateful and truly appreciate this. I'm sponsoring the show. I'm sponsoring all the free stuff I give away. It is out of my common goal if I want to give back. And I realize not everyone has access to me, and this is a way to do it. If you're listening to the podcast and do all the free stuff, sign up for the MTR Weekly, sign up for Breathe Out Attention, all that stuff, you're going to get a lot of benefit out of that. And then you have the next level of, okay, you kind of want more of my coaching, more FaceTime, get a game plan. You're going to have to invest just a little bit. The more you invest in yourself, the more you're going to get. But first, it's showing up, even if it's just for the free stuff, you're going to get a lot of. I had someone write on one of my reels, like, "Oh my gosh, the amount of information has changed my life of just watching you on Instagram." So that was pretty cool, getting my common goal of being able to help more people out there. But I'm sponsoring it. I'm paying for the podcast producer. I'm giving up my time where I could be seeing patients to help you guys out. And I really, really, really appreciate when you share it and like it. So thank you. First question. I saw your recent post about surgery. And once you cut, you can't go back. Well, I'm in a position where I did decide to cut. Am I doomed? And what can I do? No, you are not doomed. And I'm not saying never do surgery. I've sent people for surgery. There is a time and a place. I'm just saying if you have something and your first stop is a surgeon, most of the time, what are you going to expect them to do? Surgery. That's their expertise. That is what they're really good at. And you want them to be really good at that if they're cutting on you. So that's not a bad thing. But if you're wanting to avoid surgery, make a couple other stops first and get your elite conservative care management plan and try it. Exhaust all the options before cutting. So let's say you already got the back surgery. What should you be doing? First, you need to be working on your breathing. Like I said before, that free breathe out attention series, easy. We need to be breathing 360 degrees throughout our abdomen, our back, our diaphragm. We need to get out of this chest breathing and be able to feel the core, the pelvic floor, in order to activate it correctly, in order to have proper stability so that you're not causing yourself another injury. Because here's the problem that a lot of people run into with back surgery. They get one level done and they're like, wow, I feel great. This is it. This was the answer. They blow off the rehab. They blow off changing the compensation patterns that got them there in the first place and fully addressing it, including the scar tissue. And so any given time later, I've seen it as short as 4 months, as long as a couple of years of the level below or above is taking all that stress. And next thing, oh, well, we have to do that level too. And it's just a vicious cycle. This goes for your back. This goes for your neck. This is just a snowball effect. So if you had to get the surgery, or if it was deemed medically necessary and you had some red flags and there was no other options, I've seen that too. You need to prioritize the recovery and the rehab addressing the scar tissue. So after a certain amount of time, which your surgeon can prescribe for you, you need to start doing scar tissue massage. And that is as easy as going perpendicular to the scar and just little rubbing motion. So you can see on YouTube that I'm doing like my little finger. So if the scar is my pen, you're going to go perpendicular to it. And I say just take a little like coconut oil, because that's really good for everything, right? So many uses for coconut oil, and go up and down. 30 seconds. Do that a couple times a day. You're adding stimulation for your brain to rewire that spot in your back into the global pattern and proprioception. And then you're also breaking up some of that scar tissue so you don't just have this big, rigid, thick keloid. Ugh. We need to try to get blood circulating back into the area in order to heal that and heal the tissue all the way through the skin. And then, like I said, the breathing. So those two things are your first initial steps. And it's not that hard. You just got to show up and do it. And then from there, we start doing like de-stress in 20. We get into some movements where you're integrating yourself all the way from your foot up through your hips, your core, your shoulders, your neck, your hands into a global movement pattern so that you can correctly activate proper stability. And this isn't sit-ups. Please, no. If you're going to strengthen your core, you need to be doing things like planks and not sucking your belly button in, not squeezing your butt. You need to be able to feel and breathe all the way down into your hip flexors and breathe into your butthole. So you're not doomed. And I would recommend getting with either virtually or wherever you live, someone to help you along and make sure you're doing the steps correctly. And just to have like someone to touch base with of, okay, here's where I'm at. Can you check this out? What are my next steps? Is there something for my body I should be doing specifically? Okay, cool. On that, I'm going to pair this other question with that one. Can back surgery lead to plantar fasciitis? Which I love that you guys are listening and trying to make some of these connections, because we have to look globally at your whole body, not just where you feel the pain. Because a lot of times, more often than not, where you feel the pain isn't actually the root cause of the injury. I know. Our bodies are so fun. That would be boring, kind of, if your pain was exactly like you just think, okay, treat your elbow. That would get boring over time. Look at it as fun and exciting and just like you're learning and growing more about your body. Yes. And that I refer back to what I just answered. If you didn't address the scar tissue, if you didn't check yourself and reevaluate and fix some of those compensatory patterns that led to the back surgery in the first place, yes, if you're doing some of the same thing, you're putting pressure on that tissue, maybe that nerve, maybe the muscle, maybe all the way down in your feet. So they're activating different. That can lead to another injury. Yes, that's very possible. If you are struggling with this, I would highly recommend the Planter Fasciitis Game Plan. We kind of talk about all this. We go through it. It's really freaking amazing for the price that it is right now, and it's not going to stay that way. I can promise you that. Because you get me in separate short videos because, hello, I don't have a long attention span either. And we go through some of this stuff and talk about it and talk about the importance. And you get to download this worksheet where you can jot along like your results as we're going through them. It's pretty freaking cool. Next question. I hear you talking a lot about your pelvic floor. Do guys have a pelvic floor? Dun, dun, dun. The answer is yes. Yes, they do. Thank you. Thank you. Guys have a pelvic floor. A pelvic floor isn't just girls. And I think people associate that with a lot with, okay, giving birth, peeing yourself. That's just a girl thing. No, 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 no. No, 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 no. This is guys too. I mean, your butthole is part of your pelvic floor. That is why that is my motto. Breathe into your butthole. Your pelvic floor is the diaper of your core. And we want our pelvic floor to be like cute tight boy shorts that can move with you, or like the boxer briefs, hugging all the right spots. I mean, we just don't want to be walking around in a saggy, dirty diaper that doesn't know how to work and like contain itself. So yes, and what some of these pelvic floor dysfunctions can show up for in males: low back pain, groin pain, difficulty with erection, difficulty orgasming, testicular discomfort, pain, numbness, stipation, digestive issues. There's many more, but those are some of the ones the well-known ones and the not well-known ones. Even like tight hip flexors. We're talking about the pelvic floor, addressing your hips, addressing breathing. So the answer is hell yes. The last question for today. I love all these. I could go on and on, but we'll wrap up with this last one. I've gotten this now a couple times, so I feel like I need to answer it on this one. How do I know who to go to and who the right practitioner is for me? That is a really good question, because there are so many people out there, and like, who do you go to first? Well, It's going to be a little bit of trial and error. I've even had to do this myself, and I am a doctor. And I've created this I'm like kind of like a spider. I have this web of people that I can bring in as part of the team, depending on what your case is. Because sometimes I might need, if we're addressing pelvic floor, I need another doctor to come in and address the hormone aspect. I am very pro team of doctors. My clinic and my team and me, I'm not good at English, like I said. We know what we're really good at. We sharpen those skills and we stay in our lane. And then I want experts who are really good in other areas to be able to come in and do what they're good at. And combined, you have the best of the best doing what they're really good at. Your results are only going to show that. So that is one of the fun things, is putting together a team for someone. But you need to go to someone who you vibe with. You need to be kind of excited to go to the doctor. And I know that's so crazy to say, but we have so many people I've seen in my team that people are like, I just love coming to see you or having a virtual appointment with you. Like, I look forward to it. And I never thought I would say that about going to the doctor. Like, this can be fun. This doesn't have to be daunting getting better. And if you're not having fun, you're not doing it right. You are growing and learning and pushing yourself to be better. That is fucking awesome. Look at that as a win. Like, you're doing what a lot of other people aren't doing, and they're sitting on the couch just complaining. You're taking action and showing up and figuring this out, because you only have one life, one body. You might as well make it amazing. If you are struggling with anything musculoskeletal, start with someone least invasive, and then we work our way up to the more invasive treatments, such as surgery. But go to someone who's a musculoskeletal expert. We are really excited. We're launching. Oh, I'm going to spill the tea a little early. We're launching the Elite Edge Club. And what this is I've heard you all. I understand. But my schedule is 100% full all the time. I really have to turn people away. But I hear you and I want to be here for you. So I've created this Elite Edge Club where you get your first appointment virtually with me. And we're going to go through your case and get a game plan together. And I'm going to be leading that. And then I'm going to pick the doctor on my team that's best for you to follow through. It's a 3-month membership. And I'm only able to take 8 spots for this right now. And I know I've told a couple of people about it. And they're like, can we be first? I'm like, no, it's just once it's released, whoever gets those first 8 spots, follow me on Instagram at Dr. Lance. Dr. Audra Lance. I don't even know I'm so excited about this. I forget everything. And then I will open those up on my schedule for those calls. And you'll have a team of doctors on your case right off the bat. And we're going to shoot it to you straight and get you better. And if we can't do it, I'll on that call, and then we're just going to add someone in or get you to someone who can. But so this is really the only way to work with me right now and have me on your team, which I'm really excited about, to be able to offer that at this moment. And I'm not able to offer that at different times throughout the year. Take advantage of it now. It could even be like a really good gift for one of your family members or friends. So stay tuned. I'm really excited for that. Oh, and I wanted to reflect back on a question. If you are like, what is breathing through my butthole? Go back to episode 17 and re-listen to it. And I kind of take you through breathing in your butthole. And I had someone message me, oh my God, I'm totally bought in. This is incredible. I'm so relaxed. So go back, reference that. You could bookmark it and come back to it and use it kind of as almost like a meditation or a relaxation when you're super stressed out. So please send me all your questions for the next Ask Audra Anything. And I can't wait to talk to you again. Toodaloo, butthole breathers.